I used to spend hours after my clinic calling patients back and completing my charts at night after the kids are in bed. So it feels like a never-ending cycle. How am I ever going to carve out time to write my paper or how to do my research? And also by the nighttime, my brain is just so tired and I can't even work properly anymore. So I can never really get my writing done. And after maybe half a year, I've decided to change my clinic process, and since then I am able to complete my notes the moment the clinic ends, and the number of calls have dropped by 80%. Now I have gotten back 6 hours of my time per week. Hi, this is Dr. Gia. Today I'm going to share some of the strategic moves that I made so that my clinical work does not bleed into my research time, admin time, or free time. Number 1, patients need to have their labs drawn before they come for follow-up. Before, I used to do blood work only when they come into the clinic, and after that I have to call them back to go through the results. And when that happens, sometimes because they can't really grasp the concept that well, it will end up being a 20-minute phone call, and at the end they still don't really understand what I'm trying to say. There are several benefits to patients getting their labs drawn first. First is time efficiency. I don't need to call the patient the next day. Second, there is actually better patient engagement and satisfaction. When the tests are ready, we can actually spend time in the clinic discussing the results and the plan. I can turn the screen around, I can show them, and I can end the visit with a handout and action plan. Patients actually really like this. On the phone, they just don't really grasp the concept as much because as I go through on the phone, they actually have to imagine what I'm talking about, all the numbers. They have to also write down the instructions. Maybe there are also distractions from the home. In the clinic, it's only you and me, 2-person. Number 2, avoid phone call interruptions. One of the biggest productivity and efficiency killers is context switching. If I'm already doing deep work in writing and I get interrupted by phone calls, it will take me an extra 15 minutes, sometimes half an hour to get back into the zone. So I typically do not allow phone calls during my deep work session. And the question is, how can we be responsive to patients and not get interrupted all the time? So first thing is I set expectations with my patients. I tell them when to expect my call. So I tell them usually this is when I'm going to call, and I have a set block just to call a patient. Also, I give them instructions on when to call me and how soon I will call back. Once you set the expectations, patients will understand. Another important thing is to avoid phone tags. I'm sure you can relate them. You know, you call a patient, they will be busy. And then when they call you back, you're busy. So that is so inefficient and so frustrating. Now I instruct both of us, me and the patient, whenever we call, we make sure we have to give a time period or time frame where we are available so that when we call each other back, we are available. No more phone tags. Number 3, time management during the actual clinic visit. So when the medical assistant is getting a patient into a room, checking vital signs, at that time I start a note. I pre-populate whatever information I can. Then I use as many templates and phrases to make it easier. Then when I get into the room, then I'll say something like this. Hi, nice to see you. Before coming in, I actually spent some time looking into your chart and results, but I would love to hear from you. What is the reason you came to see me? There are specific reasons why I use the script. First is patients trust me more when they see that I'm prepared for the visit, so they no longer feel compelled to tell me their life story. Sometimes if you don't start with that, they will say, oh, where do I start? I think it will start in 1980. So when you prepare, they know you have some framework already, then they don't have to start so much. Then the next part of the script where I say, but I love to hear from you. It gives them the opportunity to say their own problems in their own words. So it's a balance between leading them where to start and also allowing them to express freely. Once they have given me their primary complaint, then I know what their biggest concerns are. Next, I will set the agenda for the clinic. I tell them something like this. Okay, let's focus then on these 3 things that you are most worried about. Now, if they are a person who have many complaints, so many things, and you know you can't cover it, then I change the script a little bit. I'll say something like this. Oh, thank you so much for sharing. Okay, we won't be able to address everything today, but it looks like these 2 issues are the most important to you. So let us focus on these 2, and then the rest of the issues, we'll talk about it in more detail in the next follow-up in 3-week time. Sounds good? This usually sets the expectation that we're only going to address the 2 main things. And as long as you set expectation and everybody agrees, usually the clinic gets much smoother. Next, very important step, make sure you keep track of the time and stop 5 to 10 minutes before the appointment officially ends. I usually look at the clock on my desktop screen, and for some people, maybe they use their phone vibration or their iWatch. To me, my laptop time is good enough. Why do you want to stop 5 to 10 minutes early? Because you want to use that time to give the educational handouts, order labs, additional labs, and complete your notes, and also send out the notes to their doctors. Just because this is not face-to-face time with a patient, it does not mean that you're not providing care. Ordering tests, completing your notes, and sending the notes to your patient, to the patient's primary care doctor and specialist in a timely manner are a good part of clinical care. So that's really important. Number 4, efficient charting. So as mentioned before, I spend the first 5 minutes before going into the room where I look through the chart and writing as much as I can before going into the clinic. And because I have many templates and phrases that I use, before I get into the room, usually half the note was already completed. And during the visit, I will only type certain information that's already not in the chart. How do we maintain engagement when you're using all these electronic charts and screens? Usually I'm still able to maintain eye contact because I've learned to type without looking at the keyboard. Second, if I do have to look at the screen away from the patient, I will actually verbalize what I'm typing and clarify with what I'm typing is correct. Number 3, when I actually have to look at the results, what I actually do is I swing the screen around and I show it to the patients and go through the test results with them. Patients really love that. They like to look at trends, they like to look at numbers. I say, oh, this red mark, what does it mean? Why is it not normal? Is it something to be worried about? So they really like that I'm showing the screen and being engaged with them. Number 5, efficient patient education. When I provide education, I like to use multiple modalities so that they get education in several ways: visual, verbal, and tactile. One thing I've learned to do is to go through handouts during the visit and not at the end of the visit. So I've created a two-page printed handout which has general information and some blank spaces where I can cater to each patient. I'll go through the handout with them, and then I'll look at the screen. Oh, this is your number. Then I'll write out with them. Write down the most important test results, write down their blood pressure, and then I will write down specific instructions for the visit. Then after that, I will tell them specifically to show it to their care partners, whether it's their spouse, children, or put it on the fridge door. This is key. If you don't tell them, then this sheet will be scrunched up in their bags and never to be seen again. And why this is important? Patients sometimes may not be able to articulate what they learned in clinic to their family members. And ever since I've done this written handout strategy, patients, spouses, and family members have called me to thank me. Oh, thank you so much for the handout. Every time I ask Dad what the doctor said, he would just say, I don't know. At least they know what is going on now. Number 6, handling no-shows or patients that are late. So sometimes it happens, patients don't show up or they are late. What do you do? First thing is always have tasks ready. Don't walk around, start chatting, figuring out what to do. Make sure you already have a list of things you need to do. I usually finish notes, I complete my billing, or maybe call a patient or send notes to other doctors and all the labs. Your goal is to complete whatever task you need for each patient during that clinic session. No bringing anything home. Another thing is make sure that you have a no-show or a late policy. Personally, if they are late for more than 15 minutes, that's really half the time of the clinic appointment. So they need to reschedule. I can't give a full education and can't really talk to them when there's so little time. And I will not compromise on the next patient's time. If it is urgent, I will say something like, oh, it's too late. If it's so urgent, I can only spend 2 minutes or 5 minutes with you to clarify what the next steps are, but you do need to reschedule. Having a streamlined process in my clinic has really helped bring back extra time and hours, 6 hours per week in exact. I no longer bring charts home. Clinical time does not bleed into my research or admin time. If you like this video, please give me a thumbs up and subscribe. I'll see you in the next video.